This is New York Nightly News with Chuck Scarborough, live on New York Nonstop.
Last week, the Obama administration unveiled a new drug control policy that emphasizes community-based prevention and the role of doctors in screening for drug problems. Signals a shift in the strategy in the war on drugs. Here to discuss whether it's a good strategy is Dr. Stephen Passik. He is the Associate Attending Psychologist at the Department of Psychiatry and Behavioral Sciences for Memorial Sloan Kettering Cancer Center here in Manhattan. Doctor, welcome.
Thank you, Chuck.
First of all, how big a problem are we dealing with here?
Well, it's a tremendous problem. Actually, it's two problems. We really have two giant public health problems. We have this problem of chronic pain. We're an aging society. We have 50 to 70 million people with chronic pain. And at the same time that doctors have been trying to be more aggressive about treating it, we've had this growing problem of prescription drug abuse that's affected pain patients, but also mostly non-pain patients who are also trying to get access to those drugs.
And does that explain why it's a growing problem? Simply because you're an aging population with more pain?
I think so. And you know, at the same time, doctors have been told over the last few years that opioids are a very, very important part of pain management, particularly for people with moderate to severe pain. And they've increased their prescribing of it 400% and 500%. At the same time that was going on, Granny's medicine cabinet became the place that kids went to get high.
Sure.
And over the last several years, marijuana and prescription drugs have been running neck and neck for where kids were going to start. As a father of a high school student, that really troubles me a great deal.
What are the drugs they most commonly use?
Well, the most prescribed drug in the whole country, not just the most prescribed pain medicine, but the most prescribed drug in the whole country is hydrocodone. And at the same time, hydrocodone and oxycodone are very popular opioids for the treatment of moderate to severe pain. Those seem to be the most abused.
Now, are doctors, given this knowledge, are some of them now becoming more reluctant to prescribe appropriate pain medication for patients who really need it?
I think so, and I think that's a growing problem, that they're afraid of regulatory oversight and the like, and that will put a chill into their prescribing, I think. But at the same time, I think they realize that pain is the most common reason why people come to see them.
So that brings us to the Obama administration's new take on the war on drugs, and that is to treat it more as a public health issue instead of a criminal issue. Do you think that's an effective strategy?
No doubt about it. I think there are a lot of stakeholders here. There are doctors, there are patients, there's industry. And the industry is trying to come up with safer formulations of opioids as well that will make them a little bit harder to abuse. I think we all really have to do our part to treat pain aggressively and at the same time do what we can to make these drugs less appealing to people that are just using them recreationally.
What would you tell parents to do to make sure their kids can't get their hands on the kind of stuff that can actually end up being addictive?
I would tell them it can be your kid, it can be your grandkid. And so the thing is, if you have medicines in your medicine cabinet that you're not using any longer, get rid of them. Flush them down the toilet, or take them back to the pharmacy, or go back to the pharmacy and ask how to dispose of them. But if you have them in the house, lock them up. Safeguard them, inventory them, count the ones that you have in your medicine cabinet if you're going to have them in them, so you would know if any were missing.
All right, doctor, thanks for coming in.
It's my pleasure. Thank you.